do renal. A patient is admitted with hypertensive crisis, which nursing action are essential. What is hypertensive crisis, guys? What is hypertensive? Anyone? High BP? Yeah, yeah, yes, extremely high BP. Okay, so now we are having extremely high blood pressure that can damage the organs also. So we need to watch out everything, every important organ we need to watch out because it's too high. And when blood pressure is too high, it's gonna affect your heart, it's gonna affect your brain, it's gonna affect your liver, it's gonna affect your kidney. Okay, all four major organ and rest everything definitely, but these are the main how you will see the symptoms. Place on cardiac monitoring. Hypertensive crisis can lead to cardiac dysfunction. Yes, okay, because we can even see myocardial ischemia in patient. There can be some clots, there can be some arrhythmias, so we definitely to watch that one. We need to put patient on cardiac monitoring. And what about IV hypertensives? What about B, guys? Is it necessary? Yeah. Yes, definitely. What we need to watch while administering IV hypertensive? What we need to watch? What will happen if very high blood lack of potassium? Yes, lemon. Rebound hypertension, hypotension. Yes. Okay, because it does have very rapid onset, and the best thing is that it can be titrated quickly to lower the blood pressure. We need to make sure we are administrating in a controlled manner, not too much at a time, because it can now put patient in more danger by causing organ hypoperfusion. Before that, hyperperfusion was happening, too much hypertensive, it can cause hypoperfusion and that can increase the damage. Okay, so good one. We need to watch for that one. Monitor neurological status. Yeah, we already done discussed what blood pressure can cause. If we are having too much higher blood pressure, that can cause the cerebral edema. Okay, now it's affecting the brain. So we need to see changes in mental health, neurological status, if there is headache, if there is any issue going on with vision. Yeah, pressure on all the nerves. Okay, do we need to encourage patient for oral fluids? Yeah, yes. Okay, oral fluid is incorrect. Okay, because you need to avoid it. We already had fluid volume expansion, and if you will give too much fluid, it can increase the hypertension. Okay, so that's why we need to restrict this one in hypertensive crisis. Alrighty, yeah. What about E? Monitor urine output. Is it correct? E is correct. Yes. Okay. Because why? This is the one of the thing we need to see, especially in hypertensive crisis. We already talk like how it can damage the major organs. If you having very less urine output or decrease urine output in, then it's yes it's affecting kidney functions. Okay, and that is the direct sign of acute kidney injury. So that's why we need to monitor urine output. Okay, this is one of the main thing. What about keeping patient supine? What's gonna happen with that if we will keep patient supine? What position will be recommended? No, yeah. Okay. What positions we are gonna put patient into? Yes, follow us. Okay, because if patient is in supine, what's gonna happen? It gonna increase the blood flow toward head, and that's gonna cause, increase blood pressure over there, increase the chances of cerebral edema, and that can be very severe. Alrighty. Yeah. Thank you. This is A, B, C, and E is correct. Just be always careful with IV antihypertensive. Make sure we always check the blood pressure before administering the medications. Cindy, today it's all about cardiovascular and hypertension. So we are doing topic by topic now. Last couple of weeks we were doing med-surg all together, and those lives is on YouTube already uploaded on nursing channel. Okay, a patient is receiving IV nitroprusside for hypertensive emergency. What nursing interventions are appropriate? Select all that apply. Okay. Thank you, Cindy. So we have a vasodilator here. What we need to be careful, what nursing interventions we need to keep there. A, B, C, D, F. Yes, Shane. Nice. Good one. Okay. What about A, guys? Use an infusion pump. Because nitroprusside is very, what we say, very immediate acting and have very short life. Yeah. And that's why you want to use infusion pump. You don't want to give it with push. Okay. Because at least it's going precise and controlled. Yeah. What about B, guys? Monitor blood pressure continuously. Is B correct? We know, like, we need to watch it continuously because we know it's vasodilator. If it is administered, it is very potent. If we administer a bit more, then it's gonna cause too much vasodilation, too much hypotension. Okay. So continuous arterial pressure monitoring is preferred always with B. Yeah. What about C? Protect solution from light. What will happen? Is it light sensitive or not? Thank you guys for following and sharing and double tapping. Really appreciate. Yeah, because what's happened with nitroprusside, like if it is in the sunlight, it's gonna definitely degraded. Like it can compound can be inactive and it can be cyanide. Okay, so it should be wrapped and protect from light. C. Yeah, monitor for cyanide toxicity. D. D. Yeah, we just discussed that, especially in the long term use. If somebody is using it for long term, then definitely we need to watch it. Okay, because long term use can lead to cyanide toxicity in this one. Especially like if you will see any change in neurological function, kidney functions, and pain in abdomen. That's the typical one. But most of the time we see like change in neurological functions. Yeah. Okay. Rapidly titrate dose upward. What about E? Oh, this is correct. Sorry, guys. This is correct. What about E? Rapidly titrate dose upward. Can we do it rapid or shall we go slowly? Slowly, yes, it is very potent. It is very effective medication. It is potent vasodilator. We can't go fast. Okay, we need to titrate slowly and carefully, because otherwise there will be too much drop in blood pressure. And what about F? Check for thiocyanate level if prolonged use. Yes, just to see like whether there is a toxicity going on or not. And this medicine especially metabolized by liver. Okay, so and that's why when it converts because liver converts cyanide into thiocyanate, that's the metabolite. Okay, that's why we check it. Yeah, so cyanide gets converted into thiocyanate in liver. So then it will be excreted through kidney. But if somebody is having it for the long time, definitely please make sure you guys watch for it, check for the levels. And it will, yeah, liver function test levels are also appropriate and gonna be helpful, because if those are bit elevated, then that means it's causing toxicity and damage to liver also. Thank you, Daisy. Okay, let's move to question number 13. Thank you, guys. We just hit 140 subscriber on YouTube. Really appreciate. This live will be uploaded there also. Okay. A patient taking a beta blocker developed dizziness and bradycardia. What should the nurse do? Select all that apply. So we have beta blockers and patient is having dizziness and bradycardia. We know why we give beta blockers: to slow down the heart rate. And how they do that? Because they are beta adrenergic, they block the beta adrenergic receptor, beta 1, beta 2, depend upon what kind of dose you are giving and medication you are giving. So we need to watch for that one. Okay, hold the dose. A yes, is yes, yeah. It's bradycardia, so we need to make sure like patient is having enough blood pressure to administer that one, because otherwise it can increase the bradycardia, it can lower down the heart rate too much. Okay, place on cardiac monitoring. um is it important? I think it is important, because if patient is going through bradycardia, it can be too severe, it can be arrhythmias. So we definitely to put patient on cardiac monitor too. And notify the provider, always correct, most of the time is correct. Okay, because whatever is going on is acute, uh, develop dizziness, bradycardia. So we want to notify the provider if they want to change the medication or if they want to give something else. Okay, encourage ambulation. D, why we don't want to? Why we don't want to encourage ambulation? D, no. Yes, D, no. Because we always talk about safety, and safety is the first rule. Risk of fall, yes, thank you, guys. Okay, and we are having dizziness and there is a risk of fall. If patient will fall, then there is more chances of injury. Okay, so we really don't want to encourage the ambulation. Just wait for enough blood pressure to go up, and patient when start feeling in himself or herself. Prepare to administer atropine if ordered. What about E? E is correct or no? Yeah. So E is correct, because it, especially in NCLEX also, lot of time it, this is safety if ordered. Okay, we already had safety here. We just need to check whether patients how lower the heart rate is, and it's gonna definitely pump the heart rate bit up. It's common treatment, especially to treat the bradycardia. Okay, so yeah, bradycardia, give atropine definitely. And recheck vital signs, we always do that. There can be nothing wrong about that one. Everyone happy about checking the vital signs? Yes, I will do that 100 time. I will not mind that one. Okay, thank you guys. So we have done uh yeah, no ambulation, and that's the only wrong one there. Yeah, thank you guys for sending me hurt me. Really appreciate if you are joining the team and joining the club. Really appreciate. Please join YouTube also. All the lives get posted there. Okay, the nurse teach a patient about ACE inhibitor, guys. Now we have angiotensin converting enzyme inhibitors. Which point should be included? Can somebody tell me how it work? Yeah. Yes, no BNG atropine to manage beta blocker toxicity. Yes. It's not beta blocker, it's always about bradycardia. Make sure you check the heart rate. Okay. Yeah. Alrighty. Um, so how is inhibitor work? It angioedema, signs yeah. So it work on angiotensin 1 or angiotensin 2 or angiotensin converting enzyme. Okay, so it work on angiotensin converting enzyme, and don't let angiotensin 1 to convert to 2. That is a very potent vasoconstrictor, and that's how it lead to vasodilation and help with blood pressure. Okay, most of the time, like report persistent cough. Why we need to report persistent cough? A yes. Yes, definitely A is yes, guys. Why we need to report it? Okay. So this is one of the side effect about ACE inhibitors, because ACE inhibitor alongside working on angiotensin converting enzyme, they also work on bradykinin. Okay, and when they break down the bradykinin, especially in the lungs, that can cause the cough. Okay, that can cause the cough, and that's how you have angioedema, because there is an infection, there is a yes. Okay, report swelling of lip and tongue. What about B? Is B correct? This is okay. B, yes, definitely, because this is one again bradykinin, and then you're having angioedema, and this is one of the issue with angioedema. You have swelling of lips and tongue. Okay, common indication. Angioedema is very rare, but when you have that one, that means it's life threatening allergic reaction. Okay, yeah. What about avoid potassium supplements? Is it correct or not? What can happen? Is it correct? Yes, avoid. Yes, Punjabi suit, definitely. Because ACE inhibitor can cause hyperkalemia. Okay, so we don't wanna have too much potassium supplements also. Okay, so definitely we're gonna avoid it, and we need to monitor if patient is on potassium supplements. Yeah. Yeah. Okay, and what about D? Rise slowly to prevent dizziness. D, yes. We know this medication can cause the orthostatic hypotension, and this is very common side effect, especially at starting. So D is correct. Yeah. Orthohypotensions. Yeah. Orthostatic hypotension. Yeah. Stop medication once BP is normal. E, is it long term medication, short term medication? What kind of medication we are giving? Especially if patient is on ACE inhibitor, that usually long term medication. Okay, so they should not stop the medication once BP is normal. Alrighty, so this is Incorrect. Take medication daily even if feeling well. What about um, F, guys? Yeah, because we need to manage the underlying condition, we need to keep it on. We just talk about this long term medication, so we need to make sure that patient is adherence to the medication and taking it on time. Yeah, so F is definitely yes. Thank you, guys. Thank you for sharing and double typing. Let's move to question number 15. Yeah, never abruptly stop. Never, ever. Okay. Which finding in a patient on hydralazine require follow-up? Select all that apply. Let's move to hydralazine. What kind of medication it is, guys? What kind of medication we have here? Nitrates? Okay, anyone? Yeah, yeah. So it directly affect the blood vessels, okay, giving in hypertension. So we need to know now, like chest pain, why we can have chest pain. So it's direct acting vasodilator, definitely. Um, why we can have chest pain in patient? A is yes, definitely A is yes. Yeah. Okay, so this is the medication that can cause, we discussed this medication in our last live also. This medication can cause reflex tachycardia. If you guys aware about that and remember that, because when we have reflex tachycardia, and that's what we discussed, it can increase the myocardial workload and myocardial oxygen demand, because now its reflex tachycardia, heart have to work more, and that can cause angina. Okay, that can cause angina pain, and it usually you guys will see in patient with CAD, like coronary artery disease. Okay, yeah. Okay, let's move to option B, hypotension. Can we see hypotension? Yes. Yes, because it's a potent vasodilator, direct arterial vasodilator. So you're gonna see hypotension over there. Yeah. If it is severe and symptomatic, please always recommend teach patient to see the follow-ups and doctor. Okay, reflex tachycardia. C. C is yes. And that's how we already discussed why reflex tachycardia cause chest pain. Okay, because we see reflex tachycardia, and when we have sudden vasodilation and hypotension, sympathetic nervous system get activated, and then that can activate the baroreceptors, and compensatory mechanism of heart activated, and then heart have to pump more. So that's why. Follow up means where Jashmina, where patient need to see the doctor. Okay. Okay. So we got reflex tachycardia now. Do we see palpitation also in patient or not? Yeah, because of reflex tachycardia. Thank you, Troy. Yes. Okay. Everything is about this. This medication is gonna cause hypotension, and then from hypotension you're gonna have compensatory mechanism that will cause the reflex tachycardia, and from reflex tachycardia you're gonna have chest pain and palpitation. Okay, correct. Yes, they all go into the circle. And what about mild headache, guys? What about E? Can we see mild headache in the patient or not? No. And especially you guys know, like with GTN also, hydralazine also, this is the common side effect of vasodilation. So whenever we give patient GTN also, we always talk like they can experience some headache. So always teach them like they can have, but they don't need to follow up with provider about mild headache. Alrighty. And rash with joint pain, is this expected or is this side effect that we need to watch? Yes. Okay. Especially with the hydralazine, it can cause lupus like syndrome, and so we need to watch. Yeah. So this is lupus like syndrome. This is one of the severe side effect that need follow up. Okay. Yeah. So we need to watch that one, and we request patient to see doctor as soon as possible because this is very severe. Okay. Yeah. Because SLE is happening, adverse drug reaction is happening over there. Yeah. Yeah, sister SLE. Yes, Troy. This is one of it is not SLE, but it is like mimic the symptom of SLE. We call it lupus like syndrome because it is drug induced, so that's why. Yeah. Okay, guys, we will move to question number 16, and thank you everyone who are still. Yeah, this is anaphylaxis reaction. This is adverse drug reaction. Okay, this is that one. They just give the name because you will see, especially in particular medications like isoniazid can cause this one, hydralazine can cause this one, and one of the uh, yeah is this one, LUPUS, lupus like syndrome. Yeah. Yeah. Isoniazid is very common. That one we give for TB. That medication also have. It can be autoimmune. Yeah, it is autoimmune. We don't have any single cause, and it is just like specific medication we are giving to patient, and it will do that. Yeah. What does it look like? It is like joint pain, especially rash, muscle pain, and can come with fever. Okay, it usually affect the like skin and musculoskeletal system. We don't see that much kidney and brain also, but like why it is different from SLE, because in SLE you guys, this is all due to drug, in SLE you will see more central nervous system and kidney organs involved also. Troy, our questions will be available to download by this week. All the lives that we have done, all the questions will be there. But I'm uploading the whole live on YouTube, and our channel name is Narsingi also. So all of these questions will be there. Okay. So please be with me for a few days, and we already sorted everything with our website, and we will just. What type of rash? Okay, maculo papular rash. Okay, usually we don't have butterfly rash. Sorry if somebody is writing butterfly rash. Butterfly rash is most common in SLE. Okay, so please make sure like you guys understand this is like SLE, but it's not SLE. Okay, there is a difference. Yeah, so it's not SLE. In SLE you will have Punjabi suit. Definitely we do the classes also, and our next session is gonna started after 28th of September. and we are gonna start another weekly session, 3 classes per week for. Yes, I am. I studied medicine back in India, and then I did nursing. So thank you guys for joining me. Okay. A patient developed atrial fibrillation with rapid ventricular response. Which interventions are appropriate? If you guys will just search Nursingy on YouTube and you are SINGY, you will find it. Okay. Okay. Question number 16. A patient developed atrial fibrillation with rapid ventricular response. Which interventions are appropriate? Yeah. Atrial fibrillation, guys. It is medical emergency, you guys know, because it can cause heart failure, it can cause stroke, it can cause instability in blood volume and blood circulation. Yeah, so it depends like what's your guys' interest is. Okay, it's totally depend upon everyone individual interest, like what you guys like, where you want to work, how you want to work. Okay, let's do these question, guys. Administer diltiazem IV. What about A? We are having atrial fibrillation. Punjabi Suit, we don't have any app, but we do classes on Zoom and we have Telegram also. Yes, definitely. Diltiazem is calcium channel blocker, okay? And that especially help to block the or slow down the AV conduction. And that's why we can reduce and we can control the ventricular rate. So diltiazem is a really good one with calcium. Yeah. So we definitely will say a yes. Okay. What about B, guys? What about B? And I always recommend why you are answering A and B. Please write down in comments also if you have bit of the time. Just a single word that can refer to. It's good to have the rationalization in comments also. Prepare for cardioversion. Do we need to? Yes. Yes. CCB is like William of Heart, definitely. Okay, B, cardioversion, definitely. Because I just talk about atrial fibrillation can lead to circulation unstable. Patient can be very hypotensive. Yeah, very hypotensive. So that's why we just need to prepare. We are not doing it, okay? We are just preparing, okay? So yeah, so that's why B is correct. Alrighty, monitor for hypotension, and C is, that's why C is correct. Okay, because now heart is pumping too fast and medication that we are gonna give to patient to treat it also gonna affect that one, and they can cause the blood pressure, because too fast heart rate, you can't have good blood pressure. Okay, so C is correct too. What about D? Is placing patient on telemetry appropriate? We will do 20 question and then we will take 5-minute break, guys. Yes, okay, because we want to know whether patient is in rhythm. We want to know whether patient is medications are working on the patient. So place on telemetry, definitely. Okay, and what about E? Encourage ambulation. No, patient should be on bed rest. Okay, when we are having atrial fibrillation, please recommend to put patient on bed rest. Okay, there is a very high risk of hemodynamic instability, so we need to do that. What about F? Administer atropine. Why we use atropine? In last question we did give it. Yeah, it is to bring the heart rate up. Okay, if we will give this one, it's gonna increase the heart rate and then it's gonna cause more issue. Okay, well done, guys. um, Next one, we are gonna do 4 more questions, and when then we will take break, and then we will do 50 questions today. Definitely, I think I'm very positive about 50 questions. As long as we are having few minutes break in there. Okay, question number 17. The nurse review telemetry rhythm which require immediate action. Okay, guys, we have different answers. Ventricular fibrillation. Does it require immediate intervention? Is it lethal arrhythmia? Can it be life threatening? Yes, Troy. Definitely. Okay. VF is lethal. Okay. It means patient heart is not perfusing appropriately. It can cause cardiac arrest. It need immediate defibrillation. Okay, so A is correct. And ventricular tachycardia, what about B? We know VT is okay to say it's not fib, but it can easily lead to fib. Okay, it can easily lead to fib. Most of the time, VT can be pulseless, and we don't, like know properly. Like, okay, it's happening. We need to monitor patients, and that's the one of the reason. Like, even patients are on, like monitor or something. You need to know. You need to check pulse rate by hand also. Okay, make sure you are getting enough pulse rate. Ventricular tachycardia, definitely. And what about C, asystole? We are this is, yeah, VF is more dangerous. If we are not looking after VT can lead to VF easily. VF will not give you enough time, but VT will give you some time. Asystole is definitely, guys, flat line. There is no electrical activity, so we need cardiac arrest. That is cardiac arrest. That's scary. Okay. Hi, Chitu King. So C is definitely correct. It's emergency. Okay. What about D? Sinus tachycardia, 100 beat per minute. Is it scary? What about D, guys? Is it okay? Yeah, we can manage. We can have 110 heart rate. It's bit up. Yeah, so we don't need to worry about it. It doesn't need immediate action. Yeah. We just done 17 questions, and guys, I always post the story. I always post the story when we are gonna be live. So please do watch for my stories. Okay, guys, controlled atrial fibrillation. What about next one? We have atrial fibrillations, but we have controlled ventricular rate. So, what do you guys think? It's controlled anyway. Yes. Okay, it's controlled, so we don't know. We're not gonna worry about this one also. Okay. If patient is becoming symptomatic, then definitely, but they didn't write any symptoms along with, so we will say no to this one. And what about third degree AV block? So we don't have any electrical conduction between atria and ventricles. Ventricular rate can be very slow, and yeah, it need. Yes, Chitu King, all the TikTok lives will be on YouTube, definitely. It can be 1 day delay or 2 day delay, but all the lives will be there. Promise. You guys will not miss any live at all. All the lives are on Nursingy channel. So if you joined late, you guys can watch it there. Okay. Question number 18. Which medication may be used in treatment of ventricular tachycardia, guys? Please do follow, please do subscribe nursing also and share with your friend, guys. I really appreciate your help. Please make sure you subscribe to nursing on YouTube. Okay, guys, question number 18. We have VT now, ventricular tachycardia. We need to know which medications we can give. Um, let's do some mode of actions. Let's do that. Okay, what is our goal in VT? What is our goal? Because if we know what we want to achieve, we can answer these questions easily. What we want to achieve in VT? Anyone? Normal sinus? Yes. Or to lower BP, sinus rhythm? Yes. Our primary goal is to suppress the abnormal ventricular rhythm. Okay. I don't know whether we will straight go into the normal sinus with sudden treatment or not. Depend how his patient's pulse rate is doing, but our main goal is to suppress the abnormal ventricular rhythm. Okay, so we want to make sure that is not happening. Okay, amiodarone. What about A? Can it be used for VT? How amiodarone work? Yes. Okay, because this is very amiodarone is actually one of the medication that can increase the active potential. Okay, because it work on sodium, potassium, sodium, and calcium channel, so it help to terminate and prevent VT. So it work in both way. It also terminate, it stop the VT, and it prevent. Yeah. Yes, it's sodium, potassium, and calcium blocker. Okay, so that's how it work. It's really good one. Very important medication we use in ER. Okay, second one, lidocaine. Can it be helpful? B. No. Yes. Yes. Okay. So lidocaine also have tendency to it work by blocking sodium channel. Okay, and we know sodium channel also can have conductivity, electrical conductivity over there, and excitability, especially in the ventricles. So it can help. Okay, it can help. So we can see lidocaine also. Alrighty. What about epinephrine? And in bracket it written if pulseless. So B is just because it work on, and that's why I was asking, like when we did last session on pharma, I don't. Everyone have different opinion. Okay, like this is for nurse, this is for doctor, this is for provider. We don't need to go deep. We need to be superficial. Please, I will encourage you guys at least understand the mode of action, how that medicine work, because even if you are just studying for NCLEX, or even if you are studying for like just you want to increase the knowledge, mode of action can give you why we need to give medication, what side effect we are gonna see in that patient, and how we are gonna intervene if those side effects are happening. Okay, the best thing you can learn about any medication is mode of action, and most of the time as in nurses we miss that part. We always try to grasp so much information, and we say like no, we might not need mode of action. Guys, I will really appreciate it. Just start learning one mode of action, just go with one class, and you can see how amazing you can be in that class. Okay, what about epinephrine? So we got now epinephrine is alpha and beta adrenergic agonist. They can increase the heart rate. We know they are agonists, so it can be used. Can it be used ventricular tachycardia or not? Yes. Okay, so it is definitely, especially if like we are having the cardiac arrest That's the main thing here. If patient is pulseless, that means we are having a patient with VT or VFib, asystole, everything is cardiac arrest over. Okay, so we can use epinephrine to increase the coronary and cerebral perfusion. Okay, adenosine. What is adenosine for? Is it for VT? No, yes. What thing we can use it for? We can use for SVT. Thank you, Prince. Definitely Z. Okay, so this is for SVT. This is not for VT. Okay. Um, Atropine. We already discussed that one too. When we use atropine. No, because bradycardia, yeah, this is one of the medication used for bradycardia, not for VT. Okay, so E is no. And what about procainamide? How does procainamide work? Can we use that one? Yeah. So this one is the one that we can only use for the stable VT, not unstable. Okay. So we need to make sure like we understand those medications, and that's why we are doing topic by topic, so it will be very easy. Yeah, yeah, it will be very easy to learn that. Jocelyn, pharma is easiest one. Honestly, pharma is easiest one. Okay, I will show you guys. Let's finish next two question, and I will show you my notes, my actual notes when I studied. It's only 11 pages, and I questioned everything in those 11 pages, and everything is, you will ace it. You will never worry about pharma. Okay, a patient is started on amiodarone. Which assessment are more important? Question number 19, guys. Amiodarone. What kind of medication we have? We just talk about in last question. It's antiarrhythmic. It work on sodium, potassium, and calcium pump. Yes. Um, it work on, I think, beta receptors too. Yeah. You never gave the last answer. Of course. Which one? I think we. Oh yeah. Oh sorry. Okay. So this medication we can use for stable VT. Thank you. Thank you for reminding me. I thought we talk about it already, so that's why I didn't. I forgot to tick it. Okay, we can use this for stability. Yeah, and stable like where we have rapid heart rhythm, and it always originate in ventricle. Yeah, yeah. Anyone know how this medication work? Procainamide. Sodium channel, yes. No BNG, definitely. Okay, this is the reason we need to know the mode of action. So this medication is same, it work on sodium, lidocaine work on sodium. Okay, so that's the reason. Amiodarone work on sodium, potassium, calcium channel. Fateh, we do have a pharmacy course. Next one is starting on September 28 or 9. I can show you guys poster. The poster is already, I do have. It can be per week. It can be all classes together. Okay, a patient is started on amiodarone. Which assessment are more important? We already know now. It's antiarrhythmic. It work on sodium, potassium, calcium channel. It work on beta receptors also. So let's do that. Pulmonary function. Do we need to watch pulmonary functions? Yes. It is very complex medication. Okay. what happened, because it have long half life and it can distribute into the fatty tissue and it can accumulate there, it can cause the toxicity. So that's the one of the reason it get accumulated in most of the organs. Yes, pulmonary toxicity, pulmonary fibrosis, it can cause that, guy. Okay, it can cause that. Thank you. Liver function test, again same thing. Just no BNG, definitely pulmonary fibrosis is there. What about B, liver function? Can it damage liver? Yes, it can damage liver. Okay, so always check for the elevated liver enzyme. What about thyroid? So one of the ingredient in amiodarone is iodine. Okay, so you need to watch for thyroid function also. Because it can cause hypo, it can cause hyper, it can cause, yes Nora, it definitely has iodine, so we need to watch thyroid functions. It can cause both, it can cause hypo also, hyper also, depending upon, yes, iodine too. Alrighty, visual changes. Guys, it's very complex medication. It goes into all the organs, every organ it will get accumulated. Okay, same thing again. Visual changes, it can cause neuropathy, it can lead to blindness. Yeah, so wherever it's getting accumulated, it causing problem. QT interval monitoring, what we can see in this one, will it increase or decrease? Yes, yes, prolong. So this is one of the medication that can prolong the QT interval. Okay, and we need to, because it can also increase to that extent where patient can go into torcidas. Okay, so yeah, so we need to watch for E also. And what about bowel movement frequency? What about F, guys? What about F? I will not go for F, you know, because it's not the primary concern. It's not usually, this is, so when Jashmina, you when QR prolongs, like we are not now having enough, like electrical conduction is getting slow, so it can lead to torsade days point, torsades day points. Yeah, yeah. Um, that usually goes like this. Yeah. It does, Troy, does affect everything. Yeah, it does affect everything. The only thing is that, um, yeah, the only thing, it's not primary concern. It's not that much because it's, yeah, it is common. GI is common. Okay. Yeah. So we don't need to worry about that, but like it's not that, I think. Just mean a slow electrical conductivity. Yes, it is. Okay, amiodarone. Somebody said amiodarone. So amiodarone we already discussed bit. So it work by blocking the sodium, potassium, and calcium channel. Okay, that's the only thing you need to remember. And then it work on beta receptor also, and somewhat alpha receptor. It's very potent. It's effect on everything. Okay, because it's multi-channel blocking action, and it can prolong the repolarization phase, like phase 3, and that's why you have prolonged QT interval. Okay, yes, sodium, calcium, potassium, Nora, everything. Okay, so clinical use, like why we are using it in the VT, VA, VF. Yeah, it can stop that. Supraventricular arrhythmia we can give, especially in atrial fibrillation. Yeah, just to maintain like normal sinus. but only after cardioversion. If patient having cardioversion, then we can give that one. Yeah, this is one of the medication that we really need to be careful because it have lot of side effect. Yeah, so that's the only. Yeah, it is not adverse effect. Let's move to last question, and then we can talk about more if you have any question from last 20s. Okay, the nurse is caring for a patient with a temporary pacemaker. um, which interventions are correct? 3.5 to 5 Dana, potassium level 3.5 to 5. Thank you, Gunreet. Thank you guys for following and sharing. Really appreciate. Okay, we have temporary pacemaker here. Jashmina, last question is completed, but I will talk about more about VT and Torsade pointers after this one. Yeah, because I need to post these videos on YouTube, so I post all these video on nursing. So yeah, sometimes viewers don't like our talk because they can't see your guys' comments. Okay, monitor ECG rhythm. Do we need to do that? Yeah, ABDEF. Let's see it. ABDEF. Let's see. Okay, definitely we're gonna monitor ECG rhythm because we wanna make sure the pacemaker is pacing properly. So A is correct. Keep resuscitation equipment nearby. What about B, guys? We are having no. Okay, the reason why it is yes, because it's temporary. Okay, so we need to have the resuscitation equipment nearby. It can't be no, because there is always risk of lead dislodgement and pacemaker failure. It's not the permanent one, so we need to watch for it. Okay, so B is correct. Ensure pacer wires are insulated. Ensure pacer wires are insulated. C. What will happen if it is exposed? Because it can be safety hazard, and it can be entry point for infection also. So safety is always first. Okay, so we want to make sure they are insulated. C is correct. Yes. What about D, guys? Restrict movement of extremities near insertion. Do we need to do that? D is correct or not? I will say yes for D. Yeah, because it's temporary, and I really don't want patient to do lot of movement that can cause the dislodgement. Yes, that's Nigma. Definitely, I don't want that, because that can cause further complications. So D is correct. We want to make sure patient is not playing up with the wires. Okay, monitor insertion site for infection. That's always correct, guys, for everything. Okay, E is always correct. Okay, we want to make sure we're gonna check for the sign and symptom.